Good afternoon and welcome to the Colorado Academy of Family Physicians' first lunchtime webinar. Today we have Carolyn Swenson presenting on early intervention for unhealthy alcohol use to improve health in Colorado. Carolyn Swenson is the Manager of Training and Consultation for the Screening Brief Intervention Referral to Treatment known as the ESPERT Initiative at Peer Assistance Service, Inc. Carolyn has a background as a family nurse practitioner with additional training in public health. At the end of this presentation, you will learn how to reach Carolyn, request training, technical assistance, and ask questions. We've got a couple of housekeeping items to go over, and if you have any questions, just let me know. We're actually going to give you Montan's email address, as he will be accessible that way. So if you could please either view the webinar or call into the conference line, but do not do both, because there is a 20-second delay, and it could be very confusing if you are logged into both the webinar and the conference line. If you have any issues, please contact Montan Bot at mantan@coloradoafp.org. We will be muting the conference line during the presentation, but you will have the opportunity to ask any questions at the end of the hour. If you are viewing the webinar, you may ask questions in the Q&A box on the left side of your screen at any time. We will answer these questions at the end of the presentation. And if you are looking for the documents for this presentation, they are available on our website at www.coloradoafp.org/webinars. I'm going to hand it off to Carolyn, and here we go.
Thank you very much, and welcome to this webinar. I'd like to start by acknowledging Peer Assistance Services, dedicated to quality, accessible prevention and intervention services in workplaces and communities, all focused in some way on substance use and related issues. We work with health professionals and recently incarcerated individuals and others who have experienced substance use and/or mental health challenges. And we'd like to acknowledge the federal government, the Substance Abuse Mental Health Services Administration, for the funding to the state of Colorado to implement screening and brief intervention in our state. Colorado is the only state in the nation to receive 2 consecutive grants on ESPERT to our state. We're in year 9 of 10 working on implementation of ESPERT across Colorado. So the objectives for this webinar today are, first of all, to describe how screening and brief intervention for alcohol can improve primary care services. And second, to describe the essential steps of what we mean by screening and brief intervention for alcohol. So let's go into alcohol as a health concern in the United States. Excessive alcohol consumption is the 4th leading preventable cause of death in the US, and that is after tobacco as the #1 cause of preventable death, then unhealthy diet and lack of physical activity. So alcohol ranks high as a cause of preventable death and disease, and yet it has not been addressed routinely in primary care as some of the other issues that are at the top of preventable causes of death. In a recent report from the Centers for Disease Control, alcohol was described as one of the major health problems, with 38 million adults in the US that drink too much alcohol, and yet very few of those adults actually have an alcohol use disorder. Of those people who drink too much, that 38 million, some are drinking at levels that are considered hazardous and have not yet experienced any problems. Some are drinking at levels considered harmful, and they are experiencing consequences, yet very few of these adults are experiencing an alcohol use disorder. In fact, only less than 5% of those who drink too much have an alcohol use disorder. And those individuals are also identified through screening and brief intervention, but there are a small percentage of those who can be assisted in primary care. We know that of adults who drink too much, only 1 in 6 have ever spoken with a physician or another health professional about their drinking as part of their healthcare services. And this is where we bring screening and brief intervention into the picture as a routine way to identify unhealthy drinking and address it as a routine part of care. So what do we mean by unhealthy alcohol use? This slide describes the major ways that we define unhealthy alcohol use. It's binge drinking, occasional heavier drinking. It's high weekly use of alcohol, the person who drinks above a moderate level on a daily basis or over the course of a week. It's any alcohol use during pregnancy. Fetal alcohol spectrum disorders are still the #1 preventable birth defect. And the researchers who study alcohol use during pregnancy would still strongly recommend that there's no safe amount of alcohol or time during pregnancy when alcohol is considered safe. And finally, unhealthy alcohol use is any alcohol use under the age of 21, not only because it's a legal issue, but primarily because the earlier an individual begins to use alcohol, because their brain is not fully developed, the more likely they are to experience serious consequences from alcohol and or a substance use disorder during their lifetime. So what is moderate drinking? Moderate drinking is defined for women and men, and it is defined based on quantity and frequency of alcohol intake. So the two ways we describe excessive alcohol intake is occasional heavier drinking and weekly drinking above a moderate level. For a woman, occasional drinking above 3 drinks is considered excessive alcohol intake. For a man, occasional drinking above 4 drinks is considered excessive alcohol intake. And for older men, they should follow the same guidelines as for women. An occasion is considered to be approximately 2 hours or in 1 sitting. For weekly alcohol intake, any more than 7 drinks in a week is considered above a moderate level for women, and any alcohol intake above 14 drinks per week for men is considered above a moderate level. And then there are certain people for whom alcohol is best avoided entirely. That would include individuals taking certain medications that interact with alcohol, certain health conditions that could be made worse by drinking, for example, depression, certain gastrointestinal conditions, and those who are planning to drive or operate machinery, or anyone who is pregnant or trying to become pregnant. The serving sizes of alcohol are also an important issue to address when assessing alcohol intake in a primary care setting. This slide portrays what is considered a serving size. Each of these servings contains approximately 14 grams of alcohol, and that would be a 12-ounce standard beer, 5 ounces of regular table wine, or 1.5 ounces of liquor. So this slide is summarizing alcohol use in adults in the United States, commonly known as the drinking pyramid. And what it portrays is that at the base of the pyramid, approximately 70% of adults in the US either do not drink alcohol at all, or if they do drink alcohol, they drink at what's considered moderate levels, which were just described. The tip of the pyramid, approximately 4 to 5% of adults in the United States have an alcohol use disorder. It's the middle of the pyramid, which is the group that we are most often missing if we do not screen for alcohol, and that accounts for the greatest burden of disease and death related to alcohol in the United States. Approximately 25% of the adult population that occasionally or on a weekly basis drinks above a moderate level. And this pyramid represents the general population of the United States. And from a public health perspective, it's that 25%, those who do not have an alcohol use disorder but drink above moderate levels, that accounts for the majority of the harm associated with alcohol. And when we say harm, we mean health problems, premature mortality, criminal justice and workplace problems, violence in communities, domestic violence, etc. And this population, the 25%, accounts for what we could also address most effectively through the method called screening and brief intervention, to identify early unhealthy alcohol use and intervene in a way that helps a person change the pattern of use before it becomes a more serious problem. So one of the most important things we point out as we train on screening and brief intervention for alcohol is that we know substance use disorders are preventable, as are many other chronic diseases, and yet we haven't always addressed them as a preventable health problem in the US. And we also know that the earlier we intervene to address alcohol use above a moderate level, the more likely we are to help a person change a pattern of use to prevent health and other problems and to prevent developing a substance use disorder. We also know that prevention begins very early. Years of research has demonstrated that if we can prevent a child from ever initiating alcohol or other drug use before age 21, we are virtually protecting them for life from developing a substance use disorder. And the earlier a young person starts to use alcohol or drugs, the more likely they are to develop a serious problem. We also strongly believe that alcohol is a family issue, and that's one reason we're especially interested in reaching those who work in family practice settings. Several of the ways that alcohol can be viewed as a family issue include that parents are the most important influence on early initiation of alcohol use and how much alcohol a young person will eventually end up drinking. That's through the role modeling as well as through access to alcohol. And parental restriction of alcohol access is one of the most important ways they can influence prevention in their son or daughter. We also know that alcohol is an issue that affects health across the lifespan, from preconception into older adulthood, including in elderly people, the increased risk of falls associated with even moderate drinking, especially through medication interactions. And we also feel that the family physician can play a particularly important role in addressing alcohol as a family issue throughout pregnancy, throughout childhood, and then in adolescent patients, and throughout adulthood. So exactly how does alcohol affect health? Some of the ways are well recognized, and others are not as well recognized or often thought of in a primary care setting. But depending on what research you look at least 72 health conditions have risk factors associated with alcohol use. And recently the World Health Organization estimated that more like 300 health problems and social problems have risk factors associated with alcohol use. So we know that drinking above a moderate level has acute and chronic effects. A person who drinks too much on a single occasion or in a single day is likely to become intoxicated, and that decreases coordination, cognitive function, and increases risk-taking. And many of those acute effects are well recognized, such as falls, motor vehicle accidents, assaults and intimate partner violence associated with alcohol, child abuse, Also suicide, one of the most important ways that, acute intoxication with alcohol has a devastating effect. And risky sexual encounters leading to unintended pregnancy or sexually transmitted infections. I already mentioned fetal alcohol spectrum disorders and medication interactions, which can have both acute and chronic effects. It's the chronic effects, the repeated exposure to alcohol above a moderate level, that causes the cell and tissue damage that's associated with a wide range of chronic health conditions, including increased risk of certain types of cancer, pancreatitis, and several GI problems, the addiction or substance use disorders that are well understood as associated with excessive alcohol intake, but also high blood pressure, cardiovascular diseases, nerve damage, and weight gain. For the person trying to lose weight, alcohol, especially on a weekly basis above a moderate level, could account for at least 10% of calorie intake. And of course, some people have experienced both the acute and the chronic effects of alcohol above a moderate level. So this slide summarizes some of the key early intervention opportunities where, in a general primary care setting, addressing alcohol could improve the care of the patient. Pain management. Anyone experiencing chronic pain may also be experiencing alcohol or other drug intake above a level. Before prescribing opioids, it would make good sense to understand an individual's past use of alcohol, their current usual use of alcohol, before the issue of opioids and the potential for misuse of opioids comes into the picture. Tobacco users. We know that individuals who use tobacco are more likely to use other substances, including alcohol, in a risky way. And those who are heavier tobacco users are more likely to drink more heavily. And for the individual who's experiencing both tobacco use and alcohol use above a moderate level, it will often be more effective to address both health behaviors simultaneously to help the person with both health behaviors. Depression and other mental health conditions are strongly associated with alcohol use above a moderate level. We know that alcohol, even at a moderate level, can disrupt normal sleep patterns, both REM and deep sleep, and this can increase the risk of depression in a person who's otherwise predisposed to depression and make depression symptoms worse, and the same for anxiety. Individuals at risk for suicide, it's a very important opportunity to intervene to help prevent suicide by addressing alcohol intake. Alcohol, especially occasional heavier drinking, leads to what's called or known as alcohol myopia, where a person is unable to think clearly, unable to make good decisions, and may be at much higher risk for thinking about suicide and then acting on that. A high percentage of people who attempt suicide are under the influence of alcohol or another drug when they make that attempt. So alcohol is also a proximal risk factor for suicide. And as you probably know, Colorado's in the top 10 states for high levels of suicide. So we believe that by addressing alcohol as a routine part of primary care, we will also be addressing Colorado's high risk for suicide. All adolescents, I already mentioned how early intervention for alcohol and other drugs is critically important to prevent lifelong problems with alcohol, but also the risk for a substance use disorder. And then in all women of childbearing age, and since 50% of pregnancies are unplanned, any woman who could potentially become pregnant is at risk for an alcohol-exposed pregnancy if we do not address alcohol as part of routine care. So that brings us to what we call screening and brief intervention. the method that we know can make a difference in identifying unhealthy alcohol use and intervening early. The screening part of the process refers to screening for alcohol using a validated question or a questionnaire. And the brief intervention is simply a brief conversation to provide feedback and enhance motivation to change unhealthy use of alcohol. And I'll describe each of these in more detail. So what is the evidence that screening and brief intervention for alcohol can make a difference? I'm going to highlight two of the organizations on this slide that recommend screening and brief intervention for alcohol. The U.S. Preventive Services Task Force gave alcohol screening and brief counseling a grade B recommendation in adults, which means deliver this service routinely. And the Partnership for Prevention that ranks preventive services ranked alcohol screening and brief intervention as the fourth most effective preventive services. And they assess preventive services based on the potential to decrease premature mortality and disease and cost effectiveness. Alcohol screening and brief intervention follows aspirin, childhood immunizations, and tobacco screening and brief counseling in its level of effectiveness. And the Affordable Care Act specifies that the U.S. Preventive Services Task Force recommendations be delivered as part of the Affordable Care Act essential benefits in the health plans being offered across the country now. So years of research has shown that overall, alcohol screening and brief counseling can reduce alcohol consumption by 25% in those who drink too much. And the particular target population for this service is that group of people who drink above a moderate level but do not have a substance use disorder. In Colorado, we collect data through our SBIRT initiative. And in the first 5 years of SBIRT, we've summarized the findings from screening and brief intervention in healthcare settings across the state, including primary care practices, emergency rooms, and a few other types of healthcare settings. Patients were screened for alcohol and other drug use, and those who screened at a level of risk considered hazardous or harmful received a brief intervention from a health educator, and then follow-up 6 months later among a sample of those patients who received screening and brief intervention. And overall, at 6-month follow-up, patients reported an overall 40% decrease in their use of alcohol, marijuana, or illicit drugs. And that was as measured in days of use of alcohol or the other substances. So our Colorado data has shown that this method is effective at intervening early to address alcohol and other drug use. So what is the evidence for screening and brief intervention in adolescents? The U.S. Preventive Services Task Force has concluded that currently they do not feel there's enough evidence to make a recommendation. However, the American Academy of Pediatrics does recommend routine screening for alcohol, drugs, and tobacco as part of routine patient care. And there's a strong possibility that adolescents may require a more intensive intervention when they are identified as using alcohol and drugs, or multiple interventions. And yet these interventions can be delivered in a primary care practice, and in fact it's probably the ideal place to address alcohol and other drug use as part of patient care. So let's talk about what screening looks like. So the most important thing is to use validated screening questions, one or more questions. Those questions can be self-administered on a paper form or electronically, or face-to-face administration. Either method, face-to-face or self-administered, is appropriate. In some cases, patients may be somewhat more truthful, when they self-administer screening, but there's no one right way to administer the screening. How do patients feel about being asked about alcohol as part of their health care? There was a study done just a few years ago called the Cutting Back Study. It studied primary care patients in 5 states, so a diverse patient population, and the study assessed patient attitudes about being screened for a variety of lifestyle factors, such as weight, diet, activity, and also alcohol and drugs. And fewer than 10%, fewer than 9% actually, indicated any discomfort about being screened for alcohol or felt that this information was unimportant as part of their health care. So in other words, patients actually, overall, the vast majority were comfortable with answering questions about alcohol and could see how it was an important issue for their physician to know about. So for screening in adults, we would recommend that all adults, all individuals age 18 and up, be screened routinely. And when we say routinely, we mean at least once a year, but it is certainly appropriate to even screen every visit, similar to tobacco screening, such as making it like a vital sign. And screening should assess both quantity and frequency of alcohol intake. It is possible to screen using a single alcohol question. One question about occasional heavier drinking can capture most of the high-risk alcohol use in a patient population. So this slide suggests 2 possible questions that could be used for single alcohol screening. How many times in the past year have you had 5 or more drinks in one day for a man, or 4 or more drinks in one day for a woman? And a positive score would be a patient who reports 1 or more times. An alternate way of approaching that same issue would be to ask, when was the last time you had 5 or more drinks in one day for a man, 4 or more drinks in a day for a woman? And in that case, with that question, a positive score would be in the past 3 months. And then for any alcohol use reported by a pregnant woman or under age 21, that should be considered a positive score, meaning it warrants a brief intervention. The audit screening tool, the Alcohol Use Disorders Identification Test, is another very highly recommended approach to screening adults for alcohol use. The audit questionnaire was developed by the World Health Organization. It's a 10-item questionnaire that can be easily self-administered. It's designed particularly for a primary care setting, and it helps the clinician identify hazardous or harmful use and identifies the patient who may have a possible alcohol use disorder. The audit is in the public domain and is available in multiple languages. For screening in adolescents, the recommendation is that all adolescents are screened starting at least by age 12. Younger may be appropriate, and one of the ways to approach screening, especially in younger children, is to start by asking if their friends have tried alcohol, tobacco, or other drugs. The CRAFT screening tool is the tool that we would recommend most highly for screening in adolescents. It's validated for use in individuals under age 21. It's a 6-item screening tool that can be self-administered or administered face-to-face. And that brings us to the brief intervention, the second step of alcohol screening and brief intervention. The step you take when a person has a positive alcohol screen. So there's options for how to carry out a brief intervention as well. From the very, very brief option A to a bit more involved brief negotiated interview. So when time is very limited, we would recommend that at the very least, a clinician should interpret the screening results for a patient. Explain to them why you're concerned about alcohol and their health, why you even ask about it. What do we mean by drinking above a moderate level? And then finally, second, to document that screening result in the patient record. Option B is called a brief negotiated interview, and I will explain that to you in the next several slides. It's a bit more involved intervention. It can last anywhere from 5 to 15 minutes in a typical setting. And then we would again recommend that you document screening results in the patient record. This brief intervention is ideally done at the time of screening during the same visit, but there are options for delivering a brief intervention after the visit if circumstances necessitate that it's not possible for the physician or another member of the healthcare team to address the alcohol use during the visit. So, for example, it could be a brief intervention could be delivered at a follow-up visit or over the phone. And different members of a healthcare team can provide this brief conversation to the patient. The brief intervention that I'm going to describe to you draws from the field of motivational interviewing, the spirit and the techniques of motivational interviewing, which emphasizes empathetic listening, collaboratively working with a patient to explore their alcohol use and come up with a mutually agreeable plan for changing alcohol use. And it especially focuses on exploring and resolving ambivalence, bringing that out into the open through the questions that the clinician asks the patient. It also focuses on helping the patient identify their own best reasons, their own intrinsic motivation to change a pattern of unhealthy drinking. And it respects patient autonomy. In other words, a person's choice about whether to change, when to change, and how to change their alcohol use. And it also reinforces commitment and confidence about change and helps a person troubleshoot challenges around their confidence or their ability to make a change. And we encourage that when talking about alcohol with patients, that we shift our thinking from asking why is a person not motivated, especially if alcohol is causing harm to their health or other aspects of their life, and ask instead, so what is motivating them? What's the underlying reason or reasons that a person may be drinking too much? So the method we teach most often is what's called a brief negotiated interview. It's a structured way to carry out a short conversation about alcohol. This method was developed for use in emergency departments, and it provides a way to have a conversation that can be carried out in just a few minutes, that has a beginning, a middle, and an end, and includes the key components of a motivational conversation. Step 1 is to raise the subject. Step 2, provide some feedback to the patient. Step 3, where you spend the most time in the conversation to enhance their motivation in the direction of change, reinforce their commitment to change, and enhance their confidence about changing. And step 4, to negotiate a plan and next steps and advise the patient, offer assistance if needed, so they can carry out their plan successfully. So let's go into each step in more detail. Step 1, raise the subject. This is where you would simply ask the person for permission to have the conversation, such as by saying, would you mind taking a few minutes to talk with me about your screening results? Or would you mind if I gave you some feedback about how alcohol can affect your health and why we ask about it in our practice? Most patients agree to have the conversation because they're being given the option and they're somewhat curious. Occasionally a person may say they don't want to have the conversation, and that's okay. That would bring the conversation to a close at that point. Step 2 is where you provide some feedback. The most important point about this is to not give too much information, to try to personalize the information as much as possible, similar to providing feedback on tobacco use. And some of the ways you may provide feedback is to simply review a person's reported level of alcohol intake, to review what we mean by moderate drinking and how they exceed that level. Many people really want to be in the normal range, and it can be very informative to point out to them that they actually drink above a moderate level. And that's especially true for people who do more social drinking, because they often spend time with people who drink the same amount that they drink. Another way to provide feedback is to link the alcohol use to current or possible future health concerns that you may be aware of that the patient is experiencing, and they may not be aware that alcohol could be playing a role. Another idea is to link the substance use to the purpose of the visit, especially if alcohol may have played a part in causing the chief complaint of the patient. And although we list that offering educational resources is a way to provide feedback, in general, we like to stress that education alone rarely changes health behavior. So, as I mentioned at the beginning of this slide, don't give too much information, try to personalize it. And then the other most important thing is that you ask the person to respond to the feedback. Ask them what they think about the feedback. Have they heard this before? Do they think it applies to them? That's a very important way of engaging the patient in the conversation. Step 3, enhance motivation to change, is where this conversation spends most of its time. And it can be helpful to get some sense of how ready is a person to make a change, how important is this issue to them. And in some cases, you may find that they've already been thinking about this or even making attempts to cut back on their alcohol use. So there's several ways we suggest that you can enhance a person's motivation in the direction of change and explore the ambivalence and the challenges they may be experiencing around change. One technique is what we call exploring the pros and the cons. The pros and the cons, the good and the not so good of their current level of drinking. So the way to do this is simply to ask them, what do you like about your current level of drinking or your current level of alcohol use? Let them respond, and then follow that with, what are some of the not so good things about your current alcohol use? And then summarize both sides for the patient so that they hear out loud the feedback, the reflection from the physician or another member of the healthcare team, that on the one hand, you just drink to relax and hang out with your friends. On the other hand, sometimes it causes stress in your relationship, and it's kind of hard to get up the next morning. So you brought up the ambivalence out into the open. Another technique to enhance motivation is to explore with a person how important or how ready they feel to cut back on their alcohol use, using a 0 to 10 scale. You can ask, so on a scale from 0 to 10, where 0 is not at all ready and 10 is very ready, how ready do you feel at this point to make a change, to cut back on your alcohol use, or even abstain if, in your medical opinion, that's the best option for the patient? Or you can ask them, how important is this issue to you at this point in your life? You let the person choose a number, and then you respond by asking them, what makes you choose that number? Or what makes you choose that number and not a lower number? So even if someone reports a fairly low readiness or importance to change, can be very helpful to ask them to explain, why is this even a little bit important to you? Another approach to enhancing motivation can be to explore confidence with a patient. We know that on issues like tobacco use, alcohol use, other health behaviors, many patients can see that it's an important issue, but they simply have very low confidence about their ability to change. In fact, many patients have actually been trying to change and have experienced difficulty with that and are reluctant to try again. So by bringing that lack of confidence out into the open, it allows you the chance to explore it, to help the person understand it, to help them understand that it often takes many tries and different approaches to make a lasting behavior change. So again, to explore confidence, you can ask on a scale from 0 to 10, how confident do you feel that you could make a change in this if you decided to? Let the patient respond, and then ask them, so what could help you feel more confident? What could help you move from 5 to a higher number? What are some of the barriers or the challenges you have experienced or you anticipate that you will experience if you try to make a change in this issue? And then once you've explored motivation with a patient, it brings you to the final step of a brief negotiated interview, which is what we call negotiate and advise. So this is where you come up with some mutually agreed upon next step. In some cases, that will involve a behavior change, a plan to cut back on alcohol use, for example, and in other cases, the patient will not feel that it's an important step for them to take at this point. But in all cases, it can be very helpful to ask the patient, as the first part of this step of the process, what do you think about our discussion? What are some of your thoughts, or what next steps might you like to take on this issue? If they need some help or ask for your help, you could negotiate a goal. You could make some suggestions about cutting back so that their alcohol use stays within a moderate level, or to try out cutting back to see how it affects a certain chronic health condition, such as high blood pressure. We strongly endorse that harm reduction is appropriate. If a person says they're very reluctant to make a change at this point, we encourage health professionals to talk about how a person can minimize any risks to themselves or to others if they continue to drink at the level they're currently drinking at. It's very useful to assist a patient in developing a plan by exploring what issues will be challenging. In some cases, offering input on what you know can be helpful, such as, would you like to hear what's been helpful to some other people who've decided to cut back on alcohol? Maybe some of these approaches would work for you. And then to summarize the conversation. Just briefly summarize where they're at in their understanding of alcohol use, their motivation to change their alcohol use, and the plan and the next steps that you have agreed to with them, and then to thank them for having the conversation. So although I went into considerable detail on the brief negotiated interview, we actually know from years of practice and advising clinics on this process that it really can be carried out in a few minutes, and that it can be carried out by different members of the healthcare team. And then, of course, there are times when you will identify through screening an individual who has a more problematic level of alcohol use and even a possible alcohol use disorder. And that's what the referral to treatment part of the SBIRT acronym is referring to. So what patients may benefit from further engagement and even possibly a referral to substance use treatment? The person with a pattern of binge drinking, when you learn that a person has had this pattern over many years, for example, or they've been trying to cut back and stop the binge, but it has not been successful. The person who's experienced serious consequences related to alcohol, the person who may have health consequences or other consequences such as relationships affecting their work or other areas of their life. And then the person who may meet the DSM-5 criteria for a substance use disorder. One of the most interesting things about individuals who have a higher level of alcohol use is that although there are people who absolutely will benefit from and need treatment from a substance use treatment specialist, a majority of people who cut back on even heavier drinking do so without specialty care. And that's one reason we believe that addressing alcohol use in a primary care setting makes such a good sense that more and more primary care physicians and other clinicians are able to engage with people and help them over time make the choice and be successful at cutting back on even heavier drinking. And for those who are receiving a referral to substance use treatment, we recommend that a warm handoff, a personal connection with the substance use treatment specialist who is going to do further evaluation and possibly offer treatment, is the best way to make that referral successful. Some questions that may be useful in engaging a person to explore their possible need for additional services, person who has a more serious problem. Some questions could sound like this. How does your current pattern of drinking fit what matters most to you in your life? How would you know if you are developing a problem? That question can be especially useful for the person who really doesn't see it as a problem right now. Just to explore with them, how would you know if it were becoming a problem for you? And for the person who at this point is reluctant to take steps to make a change, you can always ask them, let's say that you did decide it was a good idea to quit drinking or to cut back on your drinking. How would you go about doing it? What's the first step you would take to begin to instill the possibility of thinking about making a change, and also to instill confidence about ability to make a change once they're ready? And if you're in an area of Colorado where there's not much substance use treatment available, or even in the more urban areas of Colorado, we'd like to recommend the Linking Care database developed with the Office of Behavioral Health. This database summarizes all licensed substance use treatment providers in the state of Colorado. It's a searchable database. You can search by entering a zip code, for example, and by specifying certain types of criteria for the substance use treatment that the patient needs, such as a provider who treats women or adolescents, or offers services in Spanish, for example. This database also includes patient information, pamphlets on alcohol, and a large number of other substances. It includes prevention services, especially useful for work with adolescent patients. And it also includes recovery support service information, all searchable. And in just a few weeks, the Linking Care database will have a new face, and it will be more mobile friendly, so you can search on your phone more easily. Screening and brief intervention for alcohol is a reimbursable service. In Colorado, the Medicaid codes have been turned on. Many of the private health plans also reimburse for alcohol screening and brief intervention, as does Medicare. And if you would like further information about reimbursement for this service or technical assistance to equip your practice to be able to submit claims for this service, please contact us. That brings me to the last slide. Through the SBIRT initiative, we offer training, we offer consultation. We also train new trainers so that people can identify individuals in their own organization who can become prepared to train on screening and brief intervention. And we welcome questions. Very happy to provide assistance. So please do contact us if you would like training or more information. Thank you very much.
We'll now open it up to any questions that we have. I will unmute. And if you have any questions, feel free to ask them now. Anyone on the line? We'll wait a couple more seconds, and then if there are no questions, we'll end the call. Do we have any questions on our webinar?
Does anyone have questions on our webinar? All right.
Okay, well, thank you so much for joining us today. If you have any questions or concerns, we would be happy to answer those. You can email Monton. And thank you and have a great day.
Everyone on the webinar, thank you for joining us for our very first CFP Lunchtime webinar, and we'll be posting this on YouTube, and you'll be able to share it with everyone, and thank you so much.